Hello, good evening, and welcome back. So, the BBC are complaining that a third of coronavirus patients are ethnic minorities. As of course they are, that we all always have to make this all about race. So, there are a couple of ways to take this. I will take the stance to begin with to say that race means nothing, ethnicity means nothing, cultures have no effect, and everybody is equal no matter what. By taking that approach, and we go, oh, well, there are a third of patients, that seems unfair, doesn't it? Seeing as surely across the country they're about 15%, so why are they disproportionately high? Well, let's have a look at the areas most affected. So here we can see here that the dark was the more affected since January 31st, 2020. And if we scroll down, then of course we can see, as London is worst affected, how they are. So we have, for example, Brent being worst affected and Croydon being worst affected. So they're the two that I've picked out. And if we look into Brent, we have here, according to Brent Borough Profile, that it has the largest proportion of ethnic minorities in London. Approximately 71% of the population from an ethnic group other than white British. Right, so that's significantly higher than a third. Okay. Croydon, how about them? Well, here we have minority ethnic total, 52%. So, again, significantly higher than a third, compared to, there we go, 20%, so about a fifth. That is how we're seeing the slight difference. But given where people are most affected, that it is in those cities, because they're most densely populated, as we're seeing around the world anyway, no matter what ethnicity it is, then surely it's fair to say it isn't disproportionately high. It is akin to what we'd expect. They do go on to say, and we'll get to that, I just want to wrap up these extra tabs first, that it's because they're NHS workers disproportionately and they're most affected. Well, we have the NHS staff and percentage working age population by ethnicity. So we have the NHS workforce being the top bar. So as we can see that the white is 80%, the Asian, black and Chinese, if we wish to include those, then to come out to about 17% or less than 20 anyway, even if we include the mixed there. So in that case, you might go, oh, okay, so that's akin to the population across the country. Go, yep, okay, so are they particularly worse affected because they're disproportionately high in the NHS? No, they're not. So that's a moot point as well. So given that, if you wish to say that they're still disproportionately affected, even though it's following the trends just based on the job occupation, which they've listed, and also the places with the highest rates anyway, being that they're most densely populated, given that then, what could it be? Could it be that these cultures and ethnicities that they reference have a much higher rate of obesity, of diabetes, of drinking, of smoking, less hygienic? Do you think that could possibly play a factor? Do you think inbreeding would also lead to a lowered immune response? Well, yes, of course it would. So maybe these other things then play a factor. Is this down to British people imposing their values? No, on the contrary, it's actually down to the different cultures wishing to continue their own lifestyle in a country that is not the norm. So in a country where the norm is a healthier lifestyle, they are actively subverting that in order to continue their unhealthy lifestyles. If they wish to do that, then sure. But then when something like this comes about and they say, oh, well, these different ethnicities have unhealthy lifestyles, surely that's just a reflection of how free the UK is to say that you are free to do what you want to do. It seems crazy to suggest that, oh, it's because of racism then. And if it's down to, oh, well, they're not really getting the money because it's so bad for them here. Well, if it was so bad, then they wouldn't be here, of course. They would stay where they were from or move back there. As some people who are supposedly refugees who have gone to other countries have then decided to move back, like the family from Bangladesh who went to Finland, but then went, no, I can't quite handle the weather here, so I want to be flown back, and that had made the government pay for it. That kind of thing. So yes, it does happen. Is it on a big enough scale to suggest that they're being treated badly in these countries? No. Was the reason cited there that they were being treated badly in Finland? No. So that's what we can come to expect. But of course, hey, let's not let facts and evidence subvert the good racist narrative. So research suggests that more than a third of patients who are critically ill in hospital with a virus are from these backgrounds. It comes after Labour called for an urgent investigation into why these communities are more vulnerable. The government said it was committed to reducing health inequalities, in which case you've got to force people to do things. But that is always the case when it comes down to an NHS. But because everybody has to buy into the same health service, then of course they are responsible for your health as well, or you're responsible for everybody else's health because you are paying for them. You don't get to choose your own provider, but instead everybody is cast within the same net. That's why we have higher taxes on particularly damaging foods or drinks and the like, with tobacco and alcohol, that you have higher tax on that, because the idea being the people who consume that then need to pay more to the NHS because they'll be using it more, in which case they make their money back that way. If people aren't earning enough to pay in to be a net contributor, that's anything above about £32,000 a year. Yes, it really is that high, but then again, the top 1% of income earners are paying 27% of the total income tax. Then if they are below that line, then, as I say, they're net takers and not net contributors. Normally, as people get older, they contribute more, of course. So if you're born here, of course you're going to be a net taker for the early part of your life. And then you will endeavour to be a net contributor later on in order to raise your own family. And then your children will be net takers as well. That's how it goes, essentially. So, given that, they say only 14% of people in England and Wales are from ethnic minority backgrounds, according to the 2011 census. Yes, my numbers of 20%, that's from the latest estimates from government sources. So, of course, the BBC are going to use the lower number, and they can do that because, hey, it's the census, therefore it's accurate. Of course, it isn't. We know how much immigration has been since then, about 600,000 per year net, and therefore, no, it's clearly not going to be 14% anymore, is it? Seeing as we know that the British people are breeding below repopulation rate and the immigrants aren't, and our population is increasing. Might you like to explain how that is happening? Yeah, that percentage has clearly risen substantially. However, the Intensive Care National Audit and Research Centre found that 34% of more than 3,000 critically ill coronavirus patients identified as Black, Asian or minority ethnic. Then we get into some personal stories, which I sympathise for the family, of course I do. It was a guy in his 90s, so he was on his way out anyway, but I don't care for individual stories. I care for the data instead of this sexy beast here. Ama Awan. Whoa. Don't want to go to sleep next to those eyes. So yeah, he's saying just be careful. Another lady of whose name I can't even begin to pronounce. So she's saying, as a whole, 40% of people living in London are from ethnic minority backgrounds. It's interesting, isn't it? What do they mean by ethnic minority? Do they mean that they're not British? They don't, do they? That's why they're saying 40%. That's not what they mean. The language games. They're everywhere, aren't they? So, I see. So that must mean 60% British then, doesn't it? It's like, no, it doesn't actually. Like, how do you define an ethnic minority? And she said most of her patients were from ethnic minority backgrounds. Yep, well, it depends which borough or ward you're in particular, that is what you would expect in London. Well, of course they would. Concerned about equipment running out, yes, we'll get the private sector in to actually be able to create these things sooner, and then you'll be fine. We've seen, wasn't it, Dyson creating ventilators and JCB creating the housing units for them, that kind of thing. And then there are plenty of companies, and there's a car manufacturer I've forgotten the name of, which is 3D printing face masks as well in order to get them out quicker. And then there are other companies making ways to sanitize the face masks, and this is all done through private enterprise because, hey, then it's they drum up more support for their business, of course, if they wish to donate them, and if they don't, then hey, they can adapt and they can survive. And smaller companies tend to do better in disasters like this because they can pivot much easier because they don't have a big structure to slow them down. Like government, as it happens. Smaller government moves quicker, big one, way down. And it is meant to be that way, so you can't have some radical coming in to overthrow the whole thing. So, moving on, lady added that underlying health conditions like diabetes and high blood pressure could also be a factor. Yes, and we also know that different races, ethnicities really, do react to different treatment in different ways, and that is why that is taken into account with certain medications. You can't provide something to everybody to cure them, the same as difference in sexes or genders, whatever. There was no difference, because we're talking medically here. So yeah, good luck. That, of course, that's taken into consideration because it does affect people differently. Just like we've seen with, for example, black people not being as affected by malaria because of sickle cell anemia, because their red blood cells are not the classic Taurus donut shape, but more of a sickle C shape, that the malaria doesn't infect them as much as it does a healthier person, for example. So that which is normally a bad trait because they can't get as much oxygen around because they lack their hemoglobin, they then aren't affected by malaria as much. So it's a similar thing here. So they say they're also more likely to be in low-paid jobs or key workers, or just low-paid jobs. And living in poverty and overcrowded housing, with all choices. In low-paid jobs, choices, or key workers, crucial transport and delivery staff, healthcare assistants, hospital cleaners, adult social care workers, as well as in the NHS, she said. Well, okay, we can discount the NHS. Adult social care is taken into it as well. Hospital cleaners, that's the NHS staff, taken into it. Healthcare assistants, okay, yeah, still taken in by the NHS. Delivery staff, crucial transport. Okay, fair enough. Yes, if they are delivering them out, not that I've seen from the data I've read, but that's fine. Key workers, if they are the transport and delivery, they wouldn't have so much interaction though, would they? So that isn't really such a big contributing factor, unfortunately, for your point. But okay, living in poverty and overcrowded housing and having all the family live together, yes, of course. Having the children with the grandparents, yes, of course. But that's very much a cultural thing and could be changed if, of course, they apply themselves enough in order to earn enough money to be able to move out. I mean, obviously we've got too many people and not enough homes here at the moment, which is why the properties are far too expensive. But hey, well, once we get those numbers down, then we'll be fine. And obviously we all keep coming back to, if it is so bad, why are you here? So all of which bring them into more contact with coronavirus and so increase their risk to serious illness and death. Sure. The Department of Health and Social Care said any death from this disease is a tragedy, and there is emerging evidence to suggest that COVID-19 may be having a disproportionate impact on ethnic minority groups. So yes, it is a tragedy, and no, it's not. As part of a continuous effort to reduce health inequalities, the government will be working with Public Health England to look further into this, and we will be releasing further details shortly. Right, so it's not affecting them all, but hey, let's say you have access to information that I don't. I'll take your word for it. That's fine. What could be a contributing factor, really, if you're saying that it's down to underlying health conditions, in which case they seem to have poor health lifestyles? And that's what I've mentioned earlier with examples. And therefore, if you're trying to stop this affecting them so much, in that case, you have to deal with their health problems, in which case you're then saying, what? The poor black, brown people can't take care of themselves and we need to step in order to do it for them because we can't trust them to be clever enough and knowledgeable enough in order to just live. Even though they've done it for tens of thousands of years, well, killing each other, sure, but they've been able to live, then it doesn't seem like you need the white man to step in. It's the whole white saviour, isn't it? That I really don't think this is necessary. And if people wish to damage themselves, then of course they have to know the consequence of their actions. That you take a bit of pain now, it's a small amount of pain over a longer period of time instead of a lot of pain in a short period of time. So that's why you might forego alcohol every night. So you're having that bit of pain, but you're healthier for it. Or forego sugar. A little bit of pain, but you're better off for it. Or exercise. A little bit of pain, but you're better off for it. You might take out insurance. A little bit of pain, but you're better off for it. It's all those kind of things that just add up. It is understanding that everything you do has a consequence, and it is planning for the future, understanding the consequence of your actions that will enable you to be successful in the world, in your life, in your community, in everything that you do. You need to know your capabilities and have a plan and be able to adapt when the time comes. That is what it comes down to at the end of the day. So hopefully you can use that going into your life. Think that where's the pain that you're not accepting and brushing off, but will inevitably lead to your downfall, or at least bad pain in the future. Look at it, identify, go, well, what is actually a manageable way to stop this being a catastrophe in the future that I can take on board now? Maybe just one new thing a week. Build that into my willpower, which I can then put into other aspects of life as well, and be far better off for it. So with that in mind, until next time, smash that like button, subscribe, and have a good one.